Coronary Artery Bypass Grafting, often referred to as CABG, may sound complex at first mention, but its significance in cardiac care cannot be overstated. So today, we embark on a journey to unravel the importance and procedural insights of this crucial intervention. CABG plays a pivotal role in treating severe coronary artery disease, offering renewed hope and improved heart function to patients worldwide. So join us as we explore the intricacies of CABG, aiming to demystify its complexities and empower you with essential knowledge about this life-saving cardiac procedure. Welcome everyone, Dr. Soumya Saluja from Tip Media, and to help us navigate the complexities of an intricate yet life-saving cardiac procedure, coronary artery bypass grafting, we have with us the esteemed medical expert, Dr. Yatin Arora. Dr. Yatin Arora is a highly accomplished senior consultant and unit head, Fortis Hospital, Shalimar, Bagh, with extensive expertise in cardiothoracic and vascular surgery. Dr. Arora completed his Master of Surgery at the prestigious Postgraduate Institute of Medical Education and Research in Chandigarh, followed by an MCH in Cardiothoracic and Vascular Surgery from the esteemed All India Institute of Medical Sciences in New Delhi. In addition to his advanced training, Sir is a Fellow of the Royal College of Surgeons of Edinburgh and holds a diploma in cardiac surgery from the European Board of Cardiothoracic Surgery. Dr. Arora specializes in a broad range of complex procedures, including off-pump coronary artery bypass grafting, total arterial coronary artery bypass grafting, mitral valve repair and replacement, minimally invasive cardiac surgeries, Bentall surgery, and advanced lung vascular surgeries. Sir's special interest in pediatric cardiac surgery includes high precision procedures such as atrial and ventricular septal defect closures, repairs of tetralogy of Fallot, total anomalous pulmonary venous connection repairs, arterial switch operations, and single ventricle surgeries. Throughout his career, Sir held prominent positions, including Chief Cardiac Surgeon, Yashoda Hospital and Research Center in Ghaziabad, and Metro Hospitals in Heart Institutes in Noida, as well as Associate Consultant at AIIMS New Delhi. Sir's unwavering commitment to advancing cardiac surgery continues to positively impact the lives of his patients, making him a trusted leader in his field. Dr. Yatin Arora, Tip Media welcomes you, sir.
Yeah, thank you. Thank you, Soumya.
Thank you so much for joining us today, sir.
Yeah, my pleasure to meet you and, have a conversation with you.
Thank you so much, sir. Okay. Sir, we all recognize, that coronary artery disease, it can be a very serious and a potentially life-threatening condition. However, many individuals, they may feel a little apprehensive about undergoing a life-saving procedure, let's say CABG, जिसको
Yes.
हम coronary artery bypass grafting भी कहते हैं, right, sir?
Yeah.
So to address these concerns and enhance, understanding, I'd like to begin this discussion with the most fundamental question that what is this coronary artery bypass grafting and why is it primarily performed?
Yeah. So as the name suggests, coronary artery bypass grafting. So the coronary arteries which are diseased or
Right, sir.
they have a stenotic lesion which are blocked in common terms, we bypass it. Like the roads. The roads are
Okay,
broken, we make a bypass over road.
right, sir.
It is the same way if the coronary arteries are blocked, we bypass with artery or a vein with a different conduits.
Okay,
Yeah.
right,
And the indications being the most common are if all the three vessels are blocked. So
right.
the heart has majority of them has three major coronary arteries. So
Ji.
LAD, that is left anterior descending, left circumflex, and a right coronary artery. If all three are blocked, the CABG has the maximum uh, what I can say, has a long-term patency rates, have a long-term survival benefit over stenting.
Right. Right.
So, those are the common people, they want stenting because it is minimal invasive. It
Right.
has a short-term benefit, but the long-term benefit of CABG over stenting in a three-vessel disease, other is left main disease when the left main is involved,
Right.
especially in a diabetes. And now in
Okay.
our setup in India, the diabetes is prevalent, especially in coronary
Yes.
artery disease. So if the
Right.
patient is having coronary artery disease with three-vessel disease or a left main, even if the cardiologist say stenting, it
Yes,
will
sir.
not have a long-term benefits of a CABG. The long-term,
Right.
when all the studies of last 50 years shows that CABG is far more superior over stenting in these patients.
Right. Right. And like you just said that CABG का एक life जो long term success rate है that's comparatively better. So for
Yeah.
someone sir who has been advised with CABG, वो जाहिर बात है कि because it's a surgical procedure, so that person might be requiring some pre-surgical preparations, right? So in line with this, what specific preparations or let's say lifestyle changes या फिर pre-surgical tests and assessments are required for someone who has been advised to undergo CABG.
So once the patient is referred to us for CABG, that is by cardiologist, once the angiography is done and three vessel
Yes,
disease has been diagnosed or a left main has been diagnosed, so
right.
so we have to see because these are majority are old population. Although
Yes,
incidence is coming towards younger population, but majority are old population. So we have to
G.
see the other comorbidities which can add
Right,
a risk to these patients. So we do the
right,
basic test, hemogram, kidney tests, that is KFT, liver test, LFT. Specifically for coronary artery bypass, we do a carotid Doppler
okay,
because, yeah, so because the patient having a coronary artery disease, there is high incidence of carotid disease. So they
right,
will have the incidence of stroke, even
right,
peri-procedural risk also.
right,
We want to see the sugar control, so HbA1c, because of wound infection, the long-term results of the graph is dependent on this HbA1c level. And if
right,
the patient is hypothyroid, we see a TSH level. So
right.
these are the basic investigation we do. But if the patient is smoker, the pulmonary function test we also sometimes perform in these patients.
Okay, right, sir. And now, because you've said that usually this procedure is performed in the elderly, the senior population, most commonly, right?
Yeah.
So, ये सबसे ज्यादा apprehensive population होती है, उनमें बहुत curiosity होती है, बहुत questions होते हैं. तो उसी lines में, how is this CABG performed? The procedure, the surgical procedure performed, and what exactly does it involve?
So the bypass in surgery unit is a surgical procedure. So the most common
जी,
traditional way is we open the midline sternum. Although
okay,
now the few selected patient we do a minimal invasive by left thoracotomy, but
जी,
majority of the patient are by opening the sternum. So we
जी,
open the sternum, we see the heart, we open the
जी,
pericardium, that the
जी,
covering over the heart, and then we take the vessels by which we have to do the bypass. The most
okay,
common vessel is behind the sternum,
okay.
okay, that is left internal memory artery. And the second most common artery we use is a radial artery. We take from
Okay,
arm and the veins from the legs. So
right.
depending how many vessels has to be grafted, we take all these vessels, three or four grafts. So in the combination of this, then we bypass it. So the lesion, we know by angiography where is the lesion. So we
जी,
graft distal to it and
जी.
proximal to the aorta. So this is how the
Okay,
bypass is done.
okay, right. So technically, we are taking the grafts from the patient itself, and then we are placing it.
Yeah,
You
on
know,
the coronary arteries on the heart.
right, right. Okay. And sir, once the surgical procedure has been performed, I'm sure the patients would be requiring medication support, right? So, what medications would you prescribe your patients post CABG, and why are they essential for their recovery?
Yeah. So once the CABG is done and the patient is shifted to ICU, and in
जी,
uneventful recovery, we take off the ventilator on the same day within few hours. But
okay,
the medications which we give for coronary artery disease, are antiplatelets. So
Okay.
ecosprin and aclopidem that will go lifelong.
Okay.
So
Right.
antiplatelets are the most important medication. Second
Right.
most important medications are beta blockers. To
Okay.
control the blood pressure, to control the heart rate.
Okay. Right.
And third, especially now because the heart function is very less in referred CABT patient. So if the LV dysfunction is there, we give diuretics to
Okay.
decrease the load on the heart.
Okay.
So these are
Right.
the three most common medication. But yes, other medication, ACE inhibitor. Sometimes in a severe LV dysfunction, we give ARNIs. Other medication are there, but these three are common to every CABG patient.
Okay, right, sir. And are there any potential risks or complications which are associated with this particular procedure, just like any other surgical procedure?
Yeah. Is a surgery on the heart. So there are complications involved.
Right.
Although, it has become incredibly safe. You know,
Okay.
Unlike to the common population, which was earlier, 25 years back, it was little risky. But now we
Right.
can do majority of the bypass surgery, within less than 1% of risk, which is,
Right.
yeah,
Wonderful.
which is equal to almost stenting.
Right.
So,
Right.
and the long-term benefits outweighs to stenting in, of bypass. But yes,
Wonderful.
the immediate procedure during surgery and after surgery, first few hours are there. Most common are bleeding, infection because diabetes are there. And
Gee.
yes, a few cases, heart arrest and arrhythmias are there.
Okay, right. And so when a patient is going through that recovery phase, so the patient's experience in itself is a little different from that, of the person who's just operated, right? So what should patients expect during their recovery period? I mean, are there any warning signs or symptoms that they should look for while they are recovering after the surgery?
Yeah, so once the patient is out of ICU and he is recovering,
Ji,
we see the
ji.
blood pressure. If the blood pressure is
Okay,
maintaining, urine output is adequate, he's passing urine adequately, his heart
right,
rate is stable and the rhythm is stable.
right, right.
These are the hemodynamics, the vital sign we look out for.
Okay.
And other thing that specifically to surgery is the wound site is okay. There is
Okay.
no soakage is there. The patient is having no fever. If these are
Right.
maintained, the patient is having good recovery.
Okay. So main are the vitals, which the patients and even the doctor would be, assessing
Yeah,
and monitoring continuously.
yeah,
Right.
yes.
Okay. And sir, does lifestyle impact the success of CABG? Because you've just mentioned that the long-term benefits of CABG is way better than that of stents. Then I'm pretty sure that the lifestyle changes would be playing an important role in this success rate. So, what would you recommend here?
Of course, lifestyle, once you underwent a major heart procedure, even once you
Yes.
diagnose of coronary artery disease, there has
Right.
to be. So the
Right.
dietary changes, your daily sedentary lifestyle has to go away. So the
Right.
lifestyle changes, obviously, the smoking has to go away. It is the most
Right.
detrimental. Alcohol, we try
Right.
to limit to, whatever the minimum they can take. Oily food, especially the trans
Right.
fatty acid, it has to go away. So simple dal, roti, sabji, jo ghar banti hai, they have to,
Gee.
do with this. Once in a while, going out is okay.
Okay.
Then,
Right.
it is not a sedentary lifestyle. They have to walk.
ठीक है.
Because they are older population, we don't ask them to run and all, but having a good
Right.
30 minutes 45 minutes of good walk is very good for them, and
Absolutely.
maintaining taking their medication regularly. These are the things we ask
Okay.
them.
Right. Right. And can CABG prevent further heart issues? जैसे कि अभी हम कह रहे कि हमें लॉन्ग टर्म में इसको सपोर्ट भी देना है, हमें इसको मेंटेन भी करके रखना है, तो क्या कोई और ऐसी हार्ट कंडीशंस हैं जो ये पर्टिकुलर सर्जिकल प्रोसीजर प्रिवेंट कर सकता है?
Of course, the bypass जो हम coronary artery को we are bypassing it, so the
जी.
risk of heart attack we are reducing it.
वंडरफुल.
Yeah, so the if the risk we don't do a bypass and the triple vessel disease is still there, the risk is
जी.
high, or to the tune of 6 to 10% a year. But once
राइट.
we do a bypass, it becomes 1 to 2% a year. So we're reducing it 5 to 7 times. So all
राइट.
the risk is there, but it is less,
यस.
and it may be less severe. The patient may be able to go to hospital to get the treatment.
Right.
So the risk reduces and the intensity of the risk also reduces with bypass.
Okay. Right. Right. Then at the same time, I would say कि a surgical procedure is a surgical procedure at the end of the day. और वो
Yeah.
apprehension हमेशा रहेगा. So this is where health literacy, I believe, comes into play, right? So, sir, what role does health literacy play in making patients understand and preparing them for something that could actually be more beneficial, uh, such as CABG अभी हमने discuss किया सारा, so that patients can make informed decisions about
Yeah.
their life.
Of course, the informed decision is the most important. Because once their relative or a father or a grandfather or a mother is diagnosed, all are scared. It is a very,
Yes,
scary situation for the family. So that is
yes,
the thing. As a doctor, we have to come up. So the
right,
options to them is stenting and a bypass. So they
right.
want always stenting. But
Hmm.
now the results, immediate risk of stenting and bypass are almost equal. It is
Right,
incredibly safe of having a bypass.
right.
If a surgeon, if the commodities are very high, so we refuse sometimes CABG. No, we will not take
जी,
that.
जी,
Then stenting is done. But the
right,
bypass is incredibly safe now these days.
right,
So
right.
if as a community we know the patient has a three vessel disease or a
Right.
left main disease in a presence of diabetes, CABG has to be done to have a long term survival benefit. So if the
जी,
patient having a non ST elevation MI and a three vessel disease and patient underwent stenting, at
right.
5 years you'll see it will have they will have a equal survival, but the
Okay,
long term survival in bypass,
right,
the age will be at least 5 years more. So
right,
it will not be an immediate results what you are thinking. So the
right.
patient who is interventing CABG with stenting, he will have problems at 65, 66. With
Okay,
bypass, he may live good at 75, 80 years also.
okay,
And the
right.
reintervention rate in bypass is low. Although, yes, there are present, even
Mhm.
in stenting, the reintervention rates are there. But in
Right.
bypass, it is very low. So the multiple
Okay.
hospitalization, reintervention rates are in CBG are low compared to stenting.
So I believe that if the doctors, they sit and they spend some time with their patients and their families, trying to make them understand, I think this automatically would, improve and actually help them make a better decision for life, right? So the
Yes.
doctors need to spend more time and explain them that what are the differences and what's a better option for them. Right, sir? Okay. Great. So I'm going to summarize this wonderful session by one important question that what will be to-do list that you would recommend your patients who are undergoing CABG to ensure, let's say, better outcomes and smoother recovery?
Yeah. So, we should know the history of the patient. So, what are the
Right,
symptoms? So, we have to start from the basics. So, what are the
right,
symptoms? So,
right,
what is the past history, including, the comorbidities, diabetes, smoking,
right,
hypothyroid, hypertension, alcohol
right,
intake. So, all
right,
this history we have to take. And the lipid profile, the cholesterol has to be in control. And
right,
once they are diagnosed, whether they are on antiplatelets or not, any previous surgery, any risk
right,
factor is there. And once these tests are done, an echocardiography to know the heart function. Heart
right,
function, good heart function reduces the risk. So
right.
once they come, the CABG with 40% heart function and a 20% heart function will not have equal results.
Absolutely.
So these are the things we see, and then we
Okay.
cater the risks to the patient. We tell the patient the risk benefit ratio of bypass,
Right.
and then we,
Right.
proceed with the bypass surgery.
Okay, so I believe a thorough medical history, your heart functioning, and then I think open communication with
Of
your patient is
course.
actually, is the key to a successful CABG surgery and a long-term and a good, healthy life, I would say.
Yes.
Great, wonderful. So thank you so much, sir. I really appreciate your presence with us today, and I'm hoping that the enlightening information shared will be valuable to many families out there. So thank you so much for joining us.
Thank you. Thank you.
It's really been a pleasure. And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir. Thank you.
Thank